Hi folks, I'm Dr. Ed Beyer, Clinical Director of Beyer Regenerative Medicine in Tinley Park, Illinois. One of the things that we do in our functional medicine clinic is we do regenerative medicine, and that means we do specific things to help people that have degenerative joints, arthritic joints, bone-on-bone knee, shoulder problems, hip, whatever joint is bothering you. We do stem cells and hyaluronic acid injections to alleviate your pain and avoid surgery and medications. So we're going to talk about one of the things that we do in our clinic, and it's called hyaluronic acid injections. Maybe you've heard of them, gel injections. Very common therapy, very effective if it's done right. So we're going to talk about what is hyaluronic acid and what is its function in our joints. Now, right off the bat, I want to clear up any confusion. Hyaluronic acid gel therapy goes by several different names: Rooster comb injections, gel injections, hyaluronic acid injections, ortho visc injections, Synvisc injections, and really most accurately, visco supplementation. So this would be the term that you want to use if you do a Google search, and there's a ton of information out there. Hyaluronic acid is a gel-like substance that is naturally present in our joints and other areas of our body. It's mainly the skin and eyes. In the joints, hyaluronic acid has actually 4 different functions. Number one, it acts as a lubricant and cushions the joint. And hyaluronic acid actually binds well to water, which is why if you get this powerful therapy done, we want you to hydrate very well. We recommend that you drink half your body weight in ounces of water daily. After it binds to water, it becomes like this really viscous jelly-like consistency, allowing lubrication and cushioning of the joint and your skin and eyes if you're doing it for that. This viscous fluid not only provides lubrication, but also acts as a shock absorber within the joint. The joint that bears the most weight is the knee joint. The problem is that as we age, the quantity and potency of hyaluronic acid decreases drastically. This is why the knee joint is the most affected as we age, and it's the number one thing we see in our institute. Hyaluronic acid assists in the growth of cartilage and bone. This is point number 2. Hyaluronic acid helps in the growth and development of cartilage and bone in our joints by promoting the growth of new cells and tissue. Number 3, hyaluronic acid reduces inflammation. Hyaluronic acid plays an important role in reducing joint inflammation and thus pain caused by injury or day-to-day trauma. Once joint cartilage starts to wear thin, then that joint biomechanics or movement is altered in a negative way. It's like 2 gears not meshing right. The joint's bad mechanics only accelerates the degeneration or thinning process and creating more pain and more inflammation. It becomes a vicious cycle that you know all too well, right? Adding hyaluronic acid to this is like putting out a fire, allowing the patient a much better quality of life. Hyaluronic acid acts, number 4, acts as a scaffold or a mesh for our own stem cells, or if you get stem cells injected. Mesenchymal stem cells are the cells in our body that actually regenerate new cartilage and all other joint tissue like bone, ligaments, tendons, and synovium. We all have these stem cells, but as we age, these mesenchymal stem cells decrease in number and potency, which is why as we age, we degenerate or don't recover from injury or day-to-day wear and tear as quickly as we did when we were younger. Same thing with our skin and our eyes. What literally happens when we injure a joint, our knee for example, whether it be a traumatic injury or day-to-day microtrauma, the damaged cells, they release, like cartilage, and joint and bone and all that, they release specific chemicals into the bloodstream, and that attracts the mesenchymal stem cells to the area. These mesenchymal stem cells will actually differentiate into new cartilage, ligaments, tendons, or whatever's been damaged. However, these mesenchymal stem cells need a mesh or a scaffold to cling to and form the new cartilage or tissue. This is the function of hyaluronic acid. And this is why all of our stem cell injections contain some hyaluronic acid. But in some cases, more hyaluronic acid is required. This is especially true when it comes to the knee, the number 1 weight-bearing joint in the body. A very important point to be made is that hyaluronic acid therapy alone is temporary, whereas hyaluronic acid therapy with properly done mesenchymal stem cell therapy is more permanent. Now there's a study, a very important study done in July of 2018 from the National Institute of Health entitled Mesenchymal Stem Cells in Combination with Hyaluronic Acid for Articular Cartilage Deficit. Found the following. This study demonstrated that combining hyaluronic acid, mesenchymal stem cells with hyaluronic acid showed a much greater improvement of articular cartilage when compared to hyaluronic acid alone. Now, don't get me wrong, hyaluronic acid therapy alone is an outstanding pain-reducing therapy, but it's temporary because it doesn't actually regenerate or regrow new cells. Only stem cells can do that. It's like watering and fertilizing a bad lawn, whereas mesenchymal stem cell therapy coupled with hyaluronic acid therapy is like laying new grass seed and watering and fertilizing a bad lawn. I hope you enjoyed this information on this incredibly powerful natural therapy for arthritic knees and joints. Don't forget to subscribe for more videos on regenerative and functional medicine. We post new videos every week. And please don't forget to like and share this video with someone you care about. I'm Dr. Ed Beyer. Until next time.